Hi, welcome to Fulton Vascular. My name is Greg Fulton and I'm a vascular surgeon at Cork University Hospital. The purpose of these videos are to provide information on vascular diseases and their treatment. For more information, you can get it from our website, fultonvascular.com, or follow us on Twitter @FultonVascular. Thanks very much. We've just been talking about the fact that varicose veins are caused by disease of the superficial veins of the leg. So what are the superficial veins of the leg? Well, there are two of them. The first is the great saphenous vein, which runs from the inner aspect of the ankle, up the inside of the leg, past the knee, up the inner aspect of the thigh, draining into the deep veins up at the groin. The second of these is the small saphenous vein, which starts on the outer aspect of the ankle, and it passes up the back of the calf and into the deep veins at the back of the knee. Now, from these superficial veins, when they get diseased, there are a series of small veins draining into them, which also become diseased. They become much more visible, and these are the varicose veins with which we're familiar. So how do you treat varicose veins? Well, not surprisingly, you have to treat both the underlying cause, which are the main trunks, and also the varicose veins themselves. And therefore the surgery or the procedure tends to have two component parts to it. Now, traditionally, when dealing with the main trunk, this was done with a surgical approach. First of all, there was an operation at the groin to tie off the main superficial vein or great saphenous vein just beside the point where it enters into the deep veins. And then the great saphenous vein itself was removed using a technique called stripping. It was removed in one piece down to the knee. Now, this procedure has worked very well, it's very effective, and is still commonly used to good effect by many surgeons. However, it has, in many cases, tend to be replaced by newer techniques. Now, the most common of these is called thermal ablation, where an energy source such as a laser is used to damage the inside of the great saphenous vein and cause it to close over. Now, the way that this works is that the laser fibre is introduced under ultrasound guidance around the knee. It's passed up, and as the laser tip is parked just adjacent to where the superficial vein enters the deep vein. Then some fluid containing local anaesthetic, known as tumescent anaesthesia, is placed in around the vein under ultrasound guidance, separating out all the other structures from the vein and therefore protecting them from it. The laser fibre is then activated and withdrawn at a predetermined rate, and it delivers a certain amount of energy to each portion of the vein, causing the vein to close over. Now, this works extremely well. It's very, very well tolerated. The patient doesn't have to be put asleep. It doesn't have to be done in an operating theatre, and patients return to full activity very quickly. Now, there are other alternatives to this. One very traditional method is to introduce a foaming agent, again possibly under ultrasound guidance, deeper down the leg, further down the leg, and this passes up the great saphenous vein, causing damage to the inside of the vein and causes the vein ultimately to block off over time. Now, this is not quite as successful as the thermal ablation, but it still works very well, and is actually the best treatment for some patients for whom thermal ablation is not a good treatment option. Now, there are also some newer techniques, and the most exciting one of these is the glue treatments. And they again work in a similar way to both the foam and the laser, in that they're introduced through a catheter further down the leg under ultrasound guidance. The catheter is placed up the great saphenous vein, again just adjacent to where the vein enters the deep vein, and the glue is then delivered as the catheter is removed, and the glue then causes the vein to block off. Now, these treatments are very exciting, they seem to produce excellent results, but because they're expensive, they're not quite as readily available. So, having dealt with the main trunks, what do we do about the varicose veins? Well, traditionally the varicose veins have been removed using a treatment called phlebectomy. And this is still the most common and best treatment that we use today. Basically, the veins are marked in advance of the procedure with a pen, and the doctor, with either a blade or a needle, makes a small incision over where the vein is, and they use a microscopic hook to pull the vein out. It works very well, it's very well tolerated and produces excellent results. Another alternative is to use one of the foaming agents that I mentioned earlier and use that to inject these smaller veins. And this also works quite well in that over time these veins block off and eventually become less visible. So as you can see, there's a whole range of treatments for varicose veins these days. But the modern treatments are much less invasive than the older surgical treatments. It means that there's much more flexibility with the surgery and that it doesn't have to be done in hospital, it doesn't have to be done in an operating theatre, it doesn't have to be done with general anaesthetic, and in fact it can mean that patients go back to full activity much quicker. Thanks. Thanks very much for watching. I hope you find this video useful. For more information, check out our website, filtonvascular.com, or follow us on Twitter @FiltonVascular. Bye for now.